Good morning, everyone. Welcome to TeleShadowing. For today's session, we have Robin and Nahil. Robin completed a master's in forensic science in the UK and worked in forensic toxicology. Then, Robin decided to return to school to pursue a PhD in pharmacology and molecular sciences at Johns Hopkins University. After completing her PhD, Robin plans to attend medical school to achieve her ultimate goal of becoming a physician scientist and working in neuroscience for development of therapeutics that can improve quality of life for patients with neurological diseases. And Manahil is our second panelist. She's a medical student at the University of Maryland School of Medicine and is a published author. You guys can take it away.
All right, thank you so much, Amna. So as Amna said, Robin's a PhD candidate and I'm an MD candidate. And we'll sort of be giving you similar and also a bit of a nuanced perspective on attaining research in medicine, pursuing it, and why it's important as well. So to kick it off, why is it important to pursue research as a physician? First and foremost, we need to sort of define research, right? There's two tiers of research, two types of research, really. These big, broad branches. And Robin, feel free to interrupt me anytime because you have more experience in this. So there's prospective research and retrospective research. So prospective research is considered more, basically prospective means something that you do advanced and ahead in time. So that means you follow patients after doing a specific type of intervention, or you want to analyze after a specific type of hypothesis and independent and dependent variable is defined. And then retrospective research is basically looking back in time. So looking back after the patient has completed their course in any clinical course and looking back in time to see what could have changed, what could have been done differently, or what are some gaps that were in the clinical care that was provided, and what are some things we can do better for the future. So retrospective research is more so considered clinical research that you'll hear about, like people doing chart reviews, data abstraction from previous charts or surgeries done. And in prospective research is more so considered lab bench research, or or considered more, I guess you could say, where you do clinical trials, right? When you do a trial, that's when you put an intervention and you want to see what happens next.
So something that was really impactful for me when I started my undergrad degree, one of my professors said something like, at least 40% of what you're learning today will be wrong by the time you graduate. So to me, if you're a physician who's actually treating patients and our fundamental knowledge of the biological and physiological mechanisms underpinning disease are changing that significantly in the course of like 4 years, if you're not up to date on research, you're not going to be providing the best care for your patients.
Exactly. And there are apps called Up to Date. There are actually apps that we have to keep ourselves, future physicians sort of up to date on new clinical knowledge, new clinical discoveries, and better ways. For example, interventions. Like nowadays, I follow more cardiology like papers, and they always say, okay, no, you should give this dose of this medicine, like a atorvastatin or aspirin. It'd be better in this specific scenario. And every day, it can change almost every day, because we want to try to ensure that we provide the best possible patient care. And we know that historically, like we talked about last week on social determinants of health, historically, medicine has not always been super inclusive to everyone for various reasons. And so now that we're pushing more ethical research, we want to ensure that it's inclusive for all patients, and that is health. It makes everyone healthy, not just a specific population healthy. So Robin provides more of the physician scientist view because she's also going to be pursuing an MD. So MD PhDs are considered doctor scientists, right? You're both a doctor, MD, and also a scientist who's already made an amazing scientific breakthrough. And I'm personally just pursuing an MD. But that doesn't mean that MDs can't pursue research. In fact, a lot pursue academic medicine. I know I'm doing a lot of retrospective and clinical research. The reason why you would normally see more MDs pursuing more clinical research is because it tends to publish a little bit faster than clinical trials or lab bench research. The reason why is because you have to go through a lot of, like I mentioned before, a lot of ethical and other considerations like IRB approvals, FDA approvals as well. If you're going to give like a specific medicine, right, to humans, you want to make sure that it's ethical and safe. So that's why there's also different phases of different trials you go through. And that takes time. That takes up to sometimes 8 years, sometimes even longer. And that's why getting those results takes a little bit longer than just going back in time and doing chart reviews or retrospective research. So I think that's basically it. In terms of the importance, we know that as physicians, things keep changing. We want to stay lifelong learners and up to date. Um, all right. That takes us to our next segment on research productivity. Basically, there are a lot of different types of research experiences that we can consider as a bulk of research if you want to quantify it when we're applying for residency, and also even when you're applying to medical school. So there are posters. Posters are basically, if you guys have seen poster presentations where there are people lined up in a basically in a large hall where they present a poster and they did an experiment or did a research study and then they presented at a conference, any type of research day at your school. It could be undergrad or in medical school. Then there are also oral presentations that are delivered at conferences. Oral presentations are basically your talk. Basically, it's like an oral version of your poster presentation where you have a slide deck and you present it and just deliver the most pertinent results to your audience. So posters and oral presentations are pretty similar. It's just posters, you present them. I guess when we were provided like the option during research days, do you want to do a poster or oral presentation? Number one, it depends if it's how competitive the conference is. And number two, posters are basically you would talk about it if someone comes up to your poster, whereas oral presentations are given to a larger audience and you're expected to talk about it. Whereas in posters, you talk about it multiple times in different ways. You point to different things on your poster because it's static. And whereas oral presentations are delivering it to a larger audience and more people. I like talking, so I always opt for oral presentations. Also because I only have to say it once, whereas for poster presentations, you have to keep saying it as more and more people come. But I know some people prefer poster presentations, primarily because it's more chill, more low key, and it's more of an intimate conversation you can have, and you can also better network with people as they come up to your poster, and you can gain more opportunities that way. There's also something called abstracts. Now, an abstract, I'm not 100% sure about, what an abstract, and I know what an abstract is. Basically, an abstract, if you think about back in like high school biology class where they say, summarize your results and summarize an introduction, basically summarize your entire scientific paper in one paragraph. That's what an abstract basically is. And Robin, I don't know if you can add on if I'm missing anything for an abstract.
So typically your abstract is just what you submit when you're trying to either get a talk or a poster at a conference. But the nice thing, so if you go to some conferences are linked to journals, so they'll publish the abstract that you submitted for your poster or your talk. So then you can say that you have a published abstract.
Ah, okay. That makes sense. That makes a lot of sense. Because the abstracts I have are linked to my presentations as well. So it's sort of like a two for one, I guess you could say, like a two birds, one stone. So that is considered two separate research productivities in that sense. Now, as you guys can tell by now, it's sort of becoming very quantifiable. It's becoming a quantity game, because you can see here there's more and more journals popping up. More and more people want to get published, and there are a wide variety of journals. And basically, we might have already heard of, for example, JAMA, the Journal of the American Medical Association, the New England Journal of Medicine. There are a bunch of different journals. They have different impact factors. That's sort of what differentiates them. And an impact factor is basically your audience, like how many views does this journal get per month roughly, and then they have this really interesting like algorithm that calculates their metrics on engagement with their journals, how often it's shared. Nowadays journals are not, I mean, they're still being printed, but they're more so delivered online now, so they measure metrics for online as well. But for example, the New England Journal of Medicine still has the paper publications, but nowadays there are journals that are just they're just online now, that you can access. So if you guys remember like PubMed, or those databases are basically where these types of publications or manuscripts get published in. That doesn't mean that journals don't publish abstracts. They certainly do. They can. And also sometimes conference agendas also publish abstracts. But basically, the gold tier of research productivity is manuscripts and publications because they tend to be peer reviewed and they tend to be published in the PubMed index. And I can sort of give a visual of that. Let me find PubMed. Yes.
So the impact factor of a journal is calculated based on the number of times that the papers in the journal get cited by other papers. So it's really desirable to publish in one of those journals because then other people will be citing your work and that gives you more like numbers on your own record. So there's things called like an H index, which is based on the number of times that your papers have been cited. And so that can be taken into consideration when you're trying to like apply for a job or get into a school.
Exactly. No, thank you. I forgot about that. The H index is defined as the number of people who cite your paper. So for example, if we click on one of these trending articles, this is published in the Cell, which is a very popular journal. If you click cite, of course, this is one citation, the new Library of Medicine, but then usually it says at the bottom, like how many people cited it already. Usually if it has the full version anyways. Let's see. Here we go. So it says free PMC articles. Here it should say towards end. Yeah, here it says cited by. So there are a bunch of more articles here that basically these papers use this paper to cite it. So that means this paper gets more points, and that's in the H index and impact factor. So usually, for example, the New England Journal of Medicine, some more popular journals with higher H indexes, they get more engagement and more citations from the articles and from authors. Let's see, anything else in terms of research productivity? Oh, yes. Basically, for residency applications, what I've been told from my Office of Student Research is that manuscripts and publications that are PubMed indexed, or AKA they show up in the PubMed servers, they're considered the gold tier or the best kind of research experience. And then if you want to go down, then it's not necessarily like a tier or really what's better. It's just more so shows like where you've shown more research potential productivity. So if you want to define productivity quantitatively, if it goes, the top tier is manuscripts or publications, then abstracts, and then posters and oral presentations are sort of, you could say, similar-ish. Some people say oral presentations are a little bit better than posters just because you have a broader audience, depending on what type of conference you have brought it to. But if it's like a student research day, they give you the options. It's not really a competitive thing. You can just choose, just like I have in the past. Yeah.
I think research is one of those things where you really get into it, what you put out of it. So if you're just going into it like, oh, I just want to like have an abstract so I can put it on my CV and check a box, like I don't think that's going to be very meaningful or impactful for your life. And you're probably working with some poor, haggard graduate student like me who really cares about this project and like wants you to care about it as much as they do. So like we love it when people come in and they really want to like learn about what we're doing and get involved. And like that's how you can get like a long-term relationship with the lab because people will be excited to work with you and have you come back from year to year. And then they'll be more incentivized to like put you on their paper because you've shown up for them and been helpful in the lab.
Right. So that, again, networking really matters then here. I know that there are some papers that I've been added to where I was very passionate about the work, but I didn't have time to really like get super involved. But they added my name into the paper anyways because they knew that I had some kind of contribution, or my data abstraction of patients was used in this paper. But most of the time, it really depends on your PI or principal investigator. Some PIs don't publish bachelor's or like undergrad students. Some PIs do. So it's a matter of also, if you're an undergrad right now, ask the person that you're interviewing with, or PI or a faculty member, do you publish students who are in undergrad? Just set the expectations in the beginning, because I know many of my classmates, they went in thinking that they would get published, but ultimately, unfortunately, they were not added to the papers. It's really PI dependent. And that's really, really important. Always ask that in the beginning. Set your expectations. I know that finding research is really tough in undergrad, but in medical school, you're incentivized to do it, and your opportunities open up much, much more, and people are all over. You can tend, basically it's a different mindset once you're in medical school, but you still do need to continue your research. The only difference between pre-med and med, I would say, in terms of finding research is basically in medical school, people want you to succeed more because they know that this is your career path. This is definitely what you want to do. Whereas as a pre-med, and sometimes students choose different paths. So that's why PIs are less incentivized to have you published, but that doesn't necessarily mean anything. And also, if you don't want to ask out front, what you can do is you can actually look at their previous papers and check if they published students in the past. That's what I used to do. I used to be too shy to ask, do you publish students? I would just check their previous papers and find, oh, is this a Bachelor's of Science student or an MD or PhD student? And then I would sort of stratify who I'd reached out to based on their previous publications. Of course, it's all on PubMed, it's all public record. So definitely use that to your advantage when you're trying to find a PI. Look up if they've included students or just I know a lot of PIs who just include themselves and in like a PhD student, and that's okay because they put in the most amount of work. So it's always up to the PI how they want to make the author contributions. And Robin, I wanted to ask if you could offer any more insight into authorship, like if you, I'm sure you've spent more time with the PI and you've spent more time in research in that sector. What is the usual thought process that goes into authorship as a whole, and first author, second author, third, fourth, etc.?
So it depends. So the last author is usually the senior author. So that would be the PI of the lab, the most senior person that's like sponsoring the research, basically. They're usually the one that comes up with like the intellectual idea for the project. The first author is usually the person who makes what they would consider the most significant contribution to the project. But that can mean a lot of different things. Like you could be a first author and not have been the person that collected the data, but be the person that like intellectually conceptualized the paper and like put all the effort into writing the manuscript and doing all of the edits and responding to reviewer comments. But you could also be like sometimes an undergrad will be a first author of a paper because the PI recognizes that they did all of the main experimental work. So it could mean a lot of different things. Labs handle that differently.
So there's no specific like guide. Like I understand the first author is always the one that contributed significantly, but significantly is very subjective. And then the last author is usually the PI or senior author. But then the middle authors, I just don't know how they like arrange that. It's
It
PI
is
focused.
No, it's very subjective. A
Very
lot of
subjective,
times
yeah.
people will have conversations about this ahead of time. And like if you're doing a collaboration, there will be an agreement about like you might share co-first author with the most significant contribution from people from two different labs.
Mm.
But then as you're going down the list, it just sort of depends on like what you did. Like if you ran 600 gels and the other person just ran like one PCR experiment or something, like you should probably be ahead of them.
Mhm.
But if one person didn't do quite as many experiments, but they also helped significantly with editing the paper, then they might move ahead of you. So yeah, it is very subjective.
Yeah, and I know some students who ran 600 gels, but because they're considered a research assistant, they were not added to the paper. So it really depends. I think if you're a PhD student, then I think you would get on that paper. But I think as an undergrad student, we need to also people need to keep in mind like we need to assess our PIs and set expectations early on because research is very, very time intensive. I know even when I was just doing retrospective research, I was contributing like during my internships like up to 10 to 12 hours a week. And every hour matters when you're also studying for the MCAT, you're also getting clinical hours, shadowing doctors, and also maintaining a GPA that's good in college, right? So as a full-time student, you want to make sure that you're getting the biggest bang for your buck and join teams that number one do publish because there's some teams that don't publish for another 10 years. And if you want to publish, if that's something you want to see yourself doing, try not to go to the teams that are doing phase clinical trials unless you're very passionate about it, of course. Like unless that is the work that you want to do and pursue that, then yeah, definitely go for the clinical trials. But I know for me, I knew that I wanted to just get a publication. So I aim for clinical research. And I remember, I think that a lot of students don't realize that there are many different types of research beyond just lab bench research because during our undergrad classes, we learn a lot like we learn a lot of lab skills like gel electrophoresis, such as how to do gels, how to do PCR. And so these skills, we want to try transferring them over to research. But those are not the ones that have the highest quote unquote research productivity in terms of what you can put on your CV, like lines on your CV. It might be more impactful work. You might be working on, the next cure for cancer, and that's amazing. Of course, people are doing that. But unfortunately, and I think that's it's different. It depends on like the medical school admissions, holistic process, and then there's also residency holistic process. But it seems to me like we'll explore this a little bit more, how it's becoming this currency in academic medicine, the higher up you go, that it just matters your output, your research output, and the number of publications you provide. So that might mean you're aiming more for clinical research, but that is my bias because that's my MD perspective. But in my opinion, I think that lab bench research is the real research, the actual research, in terms of like finding cures to diseases, finding better treatments for patients, and then translating them to trials, etc.
Yeah, I think with research, like anything else, the most important thing is to make sure that you identify mentors that can really help you out and that like want to help you succeed. So like in the first year of PhD, you usually do what's called like laboratory rotations to decide where you want to do your thesis work. So you only spend like 6 to 10 weeks there. But like all of my rotations turned into publications, even though I was only in the lab for that short amount of time, because like I was working with professors who really valued like graduate students and what they were doing in the lab and wanted to help them in their career.
Ah, that's amazing. So can you tell me, Robin, what are some good qualities in a mentor? Like how can you identify a good mentor?
Yeah. So I've gotten really lucky with my mentors. They care about me, like my professional success, but also on a personal level. Like they check in with me to make sure that like my mental health is good and I'm not too stressed or overwhelmed. When I first started in the lab, we have yearly conversations about like what my goals are and what they can do to help me reach those goals. So I think that's really important. One of my mentors is also very structured. So we do quarterly goals that you submit formally, and then you do like your goals not met at the end of the quarter, which sounds a little extreme, but it's actually so nice because then as I'm going through that 3 month period, I have this checklist that I can go back to and be like, what was it that I thought I was going to accomplish in these 3 months, and what do I need to do to finish it? So I think it's just finding someone that you like can connect with and get along with, and that you feel is going to support you and be an advocate for you as you move forward.
That's very true. And when I was talking to a couple of my mentors, they tell me, I was also in your shoes once. So, they also needed mentors to get to where they are today. And mentorship is so critical in medicine, as a field because when you think about the doctor hierarchy, there's students, then there's the residents, then there's fellows, then there's attendings, then there's senior attendings. So it's always it's this hierarchy is made so that we can learn, so that we can continue. It's okay to make mistakes as students or residents because we have attendings to look after us and correct our mistakes. So it's all part of the learning process, and mentorship is huge in medicine. And I know that now that I'm a medical student, I love mentoring pre-med students because I had a medical student mentor. So it's always the mentors who want to pay back. Whenever I hear a mentor say talk about that sort of stuff, I'm like, okay, this is the right mentor for me because they understand the struggles or they still remember them. Because I know 15 years from now, will I still remember the pains I had when I was a pre-med? I don't know, right? So sometimes you might meet people who don't necessarily meet or match you in your values and goal setting. I really like that, Robin, like the goal setting thing that you mentioned. I'm going to start doing that for myself, and I'll try finding a mentor, make you my mentor to keep me in check with 3 month goals. We also, especially since it's January, and usually by this time, people's New Year resolutions are going or not going so well. So it's always good to continuously check up on yourself, not just on an annual basis. I think every month, every 3 months, having monthly goals, weekly goals, and daily goals. Having this goal setting, and I love that your mentors do that and formalize it too, and then you can keep yourself in check. And it also incentivizes you, like, hey, they're going to check up on me. Let me actually try to accomplish these goals to the best of my ability, because someone's actually checking in on me. And that's the beauty of mentorship and having a mentor. And like the thing is, on the mentor's end, now that I'm seeing it from that end, the mentor doesn't really do much. They're just motivating you because they're sort of just lighting a candle for you, and you're doing all the work. But you're inspired by them and you're inspired by their advice. Because I know the meetings I have with my mentors are only 10, 15, 20 minutes, maybe 30 minutes long because they have busy schedules, but it impacts me a lot because it impacts the work that I'm doing for 10 to 12 hours. So their little nuggets of wisdom that really help me stay grounded and stay focused on my goals too. Okay, so here is research as a currency, as we're talking about in academic medicine. I would say that there are, let me see, there's another, yeah, here we go. So this is basically a chart that tells you, it's from the AAMC, that sort of explains how, based on the type of specialty you want to pursue, um, and number of, I guess, research experiences we were talking about, and this is a combined number of publications, abstracts, posters, and conferences, or oral presentations that you've had, and stratified by quantity, and differentiating on the people who matched and did not match for the residency of their choice. So once we're in medical school, or once we get into medical school, the number one question that we're asked is, what specialty do you want to pursue? Or like, what type of specialization do you want to go into as a doctor? How I think about it is that I am a hematopoietic stem cell right now, and then I'll differentiate into a specific type of cell, whether it's a bone marrow or a heart cell, or so that's sort of how they like to tell us, because sometimes a lot of students come in with scribing experience in a specific type of specialty, like a derm clinic. Sometimes I scribed in a primary care clinic. There are people who scribed emergency medicine, the scribes, right? There's a lot of those. So our doctors tell us, we know that you're super into you know a lot of scribing, and you know a lot of the terminology in the field that you scribed for or were the medical assistant for. But we want to turn you into hematopoietic stem cells so that you can make the choice of what specialty you want to pursue, because maybe your perspective is all in, let's say, emergency medicine, as an emergency medicine scribe. And so I'm just like, you know what, I'll just do emergency medicine because that's all I know. No, we want to try exploring all the fields, and that's sort of what our pre-clerkship curriculum does. So without further ado, I'll talk a little bit about what these numbers mean. So this sort of gets into what is a more competitive specialty. More competitive specialties are considered, for example, interventional radiology, neurosurgery, ENT, plastic surgery, surgery in general, dermatology, and ophthalmology. Now, you can see a correlation from the specialties that I said are competitive. They need, or they have or they correlate with a higher number of research experiences. So that's what sort of makes them more competitive, because they require more things on your CV to match into something more competitive. So just like we say, medical school admissions are very competitive because you need a lot of things on your CV for it. Similar to these specialties, derm, by derm, I mean dermatology, short for derm. EM is not that competitive, as you can see, relative to dermatology. Of course, medicine is competitive, but when we're talking about specialty specific, laryngology is, we just call it ENT. So I think this is why, because it's hard to pronounce. But you can see ENT is also very competitive. Orthopedic surgery, and neurosurgery, and diagnostic interventional radiology is also competitive. So and you can see this, the surgeries that are a little bit higher than, if I drew a line here, you could easily see like the more competitive specialties. So this is sort of, so when a student decides that, okay, I want to be an orthopedic surgeon, they are advised to pursue more research experiences earlier on than the average medical student would. I know some of my friends are interested in orthopedic surgery, and so they're doing a lot of more research than I am, because I personally just want to go into internal medicine and they don't require that much. But if you want to do like cardiology, if you want to go into hematology, oncology, pulmonology, these are not specialties listed here because those are fellowships after internal medicine or pediatrics that you can pursue. Um, so that's a whole other ballgame. Like if you want to be a gastroenterologist or cardiologist, we've talked about this before, where like how you follow these paths. We've had physicians who are gastroenterologists or rheumatologists. They all went through internal medicine residency after medical school, and then you go again for another match cycle for fellowship, whether it be more specialization in a specific tract like GI, cardiology, and others. So anything else I should add on this, Robin? No? Okay. No, that's right. I think it's just important to keep in mind. They are saying that like this is a holistic process, and it's not just the number of publications you have that will get you definitely matched into orthopedic surgery. There are other things that you can do, such as networking with people in the field and getting really good or strong letters of recommendation. And now that step one, basically we have three licensing exams, and the first one is now pass fail, which means that step two is and step two is not pass fail. So that step two score, similar to our MCAT score back when you were pre-meds, is considered the end all be all. Like if you have a lower-ish step two score, people say don't even apply to ortho. You're not gonna get in. Of course, stratify out the noise, and you know yourself best. And so if you've networked hard enough, I feel like it's possible. And also people, let's say you don't get into let's say you don't match into orthopedic surgery your first cycle. What you can actually do is do a general surgery first year type of rotation. I know a couple, because you can see here, MD seniors are also still DO students. They're also still IMG or international medical graduates coming from the Caribbean or overseas. And so what they tend to do is they do a one type of general surgery year, or they do a research year after medical school to try to make their application more competitive. They spend that year sort of networking a little bit more and going beyond just the numbers and step two scores. So there's always ways. Just keep, if you know you want to become an orthopedic surgeon, don't let this number sort of intimidate you. It should not be an intimidating number. Again, this is just the mean number. This is not the number of publications you need to have. I think that's something very important to keep in mind as we get into this process and I guess competing for these various fewer spots. Another reason why these are considered competitive is because there are less spots in residency for these. So it's not necessarily because they require so many things. For example, dermatology in the past historically was not competitive until recent years when people started seeing, oh, it's a better lifestyle. Some like dermatology and ophthalmology are both tend to be more outpatient centric specialties. There are less emergencies relative to the other specialties. So people like that. It's a chill lifestyle. If you go on, I reference a lot of like the residency subreddits and different feedback forums where you can learn a little bit more about each specialty and residency itself. So for example, dermatology was not as competitive until recent years. As you can tell, there was this huge skincare craze, and nowadays there are 10 and 12-year-olds going to Sephora and prioritizing skincare. There's actually this headline saying that the number one thing on every 12-year-old's like Christmas wish list was like skincare products, which is really interesting to me, being so young. But I mean, prioritizing retinol and hyaluron, like I do that too, like putting retinol. But that's a whole sidebar. Basically, this is dermatology, and so these are all things that are very popular nowadays in our culture, and that's why I think it has become more competitive, where people want to become dermatologists because of popular culture. But the number of spots of dermatology have not increased. By spots, I mean residency spots. I learned yesterday from the dean of my school that residency spots are funded by the CMS, the Center for, I think, Medicare Services, which is a federal agency, which means that hospitals don't actually decide if they can increase spots or not. If it was up to the hospitals, they would increase it by a lot already. It's funding, because basically the resident salaries, which is a whole other conversation, the salaries of residents, out of scope for this topic. But their salaries are defined and funded by the federal government and taxpayer dollars. They're not funded by the hospitals themselves. So these are things to keep in mind, because there are physician shortages that we talked about last week, like in rural and underserved areas. It's really up to the federal government to fund more spots and find better solutions to increasing the number of to decreasing the physician shortages, because actually 25% of Americans are seen by a nurse practitioner and not a physician. Whereas, like we said last week, like healthcare is a fundamental human right. So if someone wants to see a doctor and they're not able to, it's because of a shortage, and so they have to see other providers and other healthcare providers on this healthcare team. But anyways, that's a lot about dermatology, but basically it is basically the reason why some of these specialties are more competitive than you would think that they are is because there are less spots. Basically, that's to summarize. Just to summarize that.
And I think probably the most important takeaway here is like, don't look at this as like a scary, intimidating number. Think about it as like, if you're going to be doing research in medical school, you're going to be picking something that you're really passionate about. So you're going to be like excited to be going in and like doing this. And if you're not, then you should probably pick a different lab. So if it's something that you like really care about it and you're excited to go in and do it every day, then like this isn't like a chore.
100%. Every mentor I talked to in the beginning of medical school asked me, is this something you really like doing? Like, is this idea good, or do you want to adjust the idea? Like, how do you want to do it? Because for our medical school, it's actually a graduation requirement now, to have research and be productive in our research. And if we're not, we can't graduate. So, and it has to be like a first author type of publication or abstract. So that's a lot of pressure, but we can do it. And our mentors are prepared to help us through that process. But because I have to be a first author, they check in with me like, is this something you're really passionate about? Like, or do you feel like you're going to waste your time? Because in medical school, your time is even more valuable than it was in undergrad. In undergrad, I feel like I could get away with studying for the test a few days in advance. In medical school, when I have like 3 weeks left till the exam, that's when alarm bells start ringing in my head. And I just want to dedicate all my time to studying and making sure that I do well. Um, so yeah, all the time you spend in extracurriculars and research tends to be limited, but that's why Robin mentioned like it's the things that you're truly passionate about doing and you want to make time for it. Because if you're not passionate about it, you're not going to make time for it. Similar to studying, like if you're not passionate about it, you're not going to make time for it. But yeah, this is the graph from the AMC, and don't let it intimidate you. You can get through it. Basically, like it's like we've learned, like abstracts can also be considered, or basically a presentation. I know one of my presentations got published as an abstract too, so that's considered two already. So that means I already fit the internal medicine thing. If I and also another point I forgot to mention is that your undergraduate experiences carry over for research. Now they don't carry over for other things like if I was a president of a club in college, I wouldn't put that on my residency application. But if I did get published or an abstract was published in undergrad or 2 years ago, 5 years ago, that's still considered part of this number. So people can come into medical school already having their boxes checked with research. That's also a really positive thing about your publications because they stay with you. Whereas I guess traditionally, I know in college, I was told, wipe everything you did in high school. None of that matters anymore for your college resume. And now medical school is the same thing again. Nothing matters from college except your research productivity. But yeah, I think this is something from like I guess why research is important for medical school admissions specifically. Nowadays, more and more students are pursuing research. Back like I guess 15, 20 years ago, it was not as common for students to pursue research alongside their studies and clinicals and volunteering. Nowadays, there's sort of a three-pronged approach to medical school admissions. There's volunteering, to the community and also in healthcare, if applicable. Volunteering to and community service, that's one prong. Number two is clinical experience itself, like the time you spend with patients. And then number three is research. I guess those are the three major categories that we now dedicate ourselves to during undergrad as a pre-med. So now this is something that my pre-med advisor would tell me, like, why do we need research? We're not a PhD student yet, I'm not a scientist yet. So why do I need to have research if I'm not even interested in it to begin with? I guess their argument is that it shows that you're a lifelong learner. It shows that you're going to be keeping yourself up to date. And it shows your professionalism. What I find like one of the best things that I would say I took away from research as someone who was not super passionate about research in the beginning, was that it really helped me gain early exposure to a specific field. So I did a lot of orthopedic surgery research. I was not interested in surgery. It was just the research I was able to find, and they would publish me in it. But I did a lot of chart reading and abstraction. So now I'm much more fluent in the language of orthopedic surgeons. And what is a TKA? Like when we were speaking a lot of acronyms, it's actually a total knee arthroplasty. But what is arthroplasty? It means joint replacement. So these are things that come to mind immediately because I've done so much research in it. And now I know that when we get to our unit on bones and musculature and I guess learning more about ortho, I would already be a little bit more attuned to it, similar to if someone did research in emergency medicine. They come in with this knowledge set that you learned through this journey. And I think that's a huge benefit. And especially like reading doctors' notes, you'll sort of learn the process of what it's like to document and chart taking. That's a huge advantage to have. Every medical student I've talked to who I asked them if you could go back, back when I was a pre-med, if you could go back and redo something in pre-med, what would you do differently? And the large consensus is that students wish that they had spent more time charting or documenting or reading charts at least. What I mean by that is they wish they were scribes, basically. So medical scribe versus medical assistant. So they said I wish I scribed more because that way I would have had more knowledge of medications, medication dosages because you have to know generic names, brand names, and this is all stuff you can learn through research as well. So besides just medical scribing, because not everyone can get these opportunities. So research is definitely a great way to become more fluent in the new language of medicine, I would say.
Also, if you're thinking like big picture kind of scope, like we all are in medicine because we want to positively impact people's lives. But if you think about research, so I work in drug discovery. So if you have one FDA approved drug that comes out of the work that you did, you can impact more lives in one day than a physician can in their entire career. So, so sometimes we think about like, oh, well, doctors, we're the ones that are really helping people. We're like day to day interacting with them, and research is just like the thing that I do in the lab, like I'm pipetting. But actually, you can have a huge impact on quality of patient life through research. So having that kind of perspective, I think, can help make it feel more relevant and important.
It's very life-changing. That's very impactful. And I have classmates who are MD, PhD students. They're on the track. So that first they'll do 2 years of MD and then they'll do their PhD and then come back for their third and fourth year of medical school. And they say the same thing. That's their big picture thinking as well, because they want to be the ones making the actual true life-saving treatments that can impact millions of lives more than a physician can throughout their entire lifetime. So thank you, Robin. I couldn't have said it better myself.
The other thing to remember is when you're applying to MD, everything on your application is fair game for them to ask you about. So if you have done research, but you like didn't really care about it, don't really understand the project, that might come up and it won't look good if you don't understand why you were doing what you were doing or like can't explain the process or like how you were involved. So just be intentional about the things that you do so that you can describe them in an excited, passionate, informed way whenever you're going into your MD interviews.
100%. One of my mentors actually told me before they became a mentor, they were interviewing me and getting to know me better. They asked me about my research experience. And when I talked about it, they said, this is how I analyzed you. I didn't really listen to what you were saying in terms of what the research stuff you were talking about, but rather how you were saying it, how passionately you were saying it, the shine in your eyes, and also the diction or verbiage you were using. So instead of saying, they did this, they did the day, like as they, aka my research team, I said we worked on this data abstraction. And it was natural because I didn't know that at the time, but use we language if you are part of that team. And that's how people can actually tell during medical school interviews, did you actually do this research or is this what your team did? So you would say, oh, well, what my for example, my biostatistician did this and my mentor did that. And then you can say I did, and also using we and I language on owning the research that you did and on your application. That's actually a really good tip, like across all fields. Like when you use we and I language, that and subconsciously it shows that you actually did the work and that you put in the work, and you're also passionate about it. Like I would say one of the best pieces of advice I've gotten for a medical school interview is it doesn't matter what you say sometimes because every pre-med tends to have these boxes checked, but rather how you say it, how passionate you are about the topic, how you can excite the other person about what you're talking about, even if you're not excited about it yourself or you wouldn't pursue it yourself, right? Like when Robin talks about research, I get very, very excited, even though I wouldn't consider myself super enthusiastic about research. My mentors know this too. My research mentors, especially, have talked about it many times. And they know like research isn't for everyone, but unfortunately, like I said before, and also fortunately, it is it is a currency in academic medicine. And it's sort of how you can climb the hierarchy and as a physician once you are in your career. Academic medicine is basically this field where you pursue roles as a professor, associate professor, assistant professor, professor, and then chair of a department, depending on your specialty. So that's sort of also like a huge role that plays into your promotions are the number of publications you have and also the impact you have with your publications. All right. Now I want to delve into how to actually get involved in research. Now that we've convinced you, you should definitely pursue research. It's a great field to go into. You'll learn a lot for sure, even if you don't really want to do it at first, like I did. I was sort of dragging my heels in the mud. But I do come out of it saying, and I currently am doing research. I do come out of it saying it's beneficial. Definitely, I would recommend anyone to pursue research. It's increasingly important as well in the medical school admissions process. So just like the MCAT, even if it's not something you want to do, like the MCAT, we should do it. Because this is especially impactful, because it can actually impact patients and families. Because one of my research publications was actually presented during a policy hearing to change a specific policy for rural patients. Because my interest is always in policy making and in big picture thinking and leadership, I was able to sort of present my research to a senator, and that senator took that publication and showed it to her other senators, and they all voted to pass a specific policy, which was impactful for my state. So I think that, there are other ways you can use research beyond just treatments. Of course, that's the traditional and the actual science and medicine, but there's also policy considerations to make from the retrospective research that you can do. Sometimes, like if a patient is doing worse, you do question, like, is this because the hospital policies are bad, or is it because of the patient not, following through instructions? So there are ways that hospitals consistently improve their quality. It's called quality improvement. Every department has to do this, the QI initiatives. And there are different avenues you can approach. Like if you're super passionate about education and sociology and psychology, you can still get involved in that research as a pre-med. I know a lot of my friends, classmates, they came in with psychology research, they came in with sociology research or law research or policy research. I wouldn't say medical school, like medical school admissions specifically say you have to have science research. So research is research because you are advancing. It's actually like a core competency that they're looking for. They just want to see, are you able to think outside the box and see that and sort of advance society in a specific way. Of course, I didn't. It is better to get clinical research, but it's not always feasible for students to get that as an undergrad, especially. I would say a lot of mentors are looking for more medical students to mentor. So why wouldn't they mentor a medical student instead of a pre-med student? So, with that said, you don't always have to have research in science. You can always do it in policy and law and other fields as well, because they're also publishing things. And Robin, I'm sorry, you wanted
No, I
to
was just
interrupt.
gonna say, you were talking about core competencies. Research is a great way to sort of knock out all of them, like working in a team, showing resilience, showing problem solving, like all of the things they want to see you have to deal with when you're trying to do a research project.
Right. No, that's true. I forgot about that. There's more. It really does fulfill all your other core competencies. I highly recommend looking up the AAMC core competencies and then just seeing like how your experiences align. Like you probably have multiple experiences. So try to see, okay, so this one experience can actually apply to 5 different competencies on this checklist. And then just sort of tailoring your application to fit these competencies. I think that's like you're following a rubric, sure, but you are also still showing and showcasing that you are beyond your numbers, beyond your GPA, beyond your MCAT, that you are a well-developed human being and ready to serve people and patients. And I know that during interviews, interviewers are told, like, do you see this person that you're interviewing taking care of your family members? Do you see them taking care of your mom, your dad, yourself? And that's the question that they're trying to answer when you are interviewing with them. And they can see that through how you talk about your experiences, including research. Um, but yeah, I think let me see if there's others. Oh yeah, okay. So now let's talk about like how to actually get research and get involved. So number one, this is one way I tried. It's not successful for me, but I've heard it's successful for others. Attending conferences, like networking. There are a lot of scientific conferences going on where you can connect with very established and popular authors and mentors and faculty members. Even if you're not a student yourself, you can actually go and attend them still. Sometimes they come with a small fee. Like for medical students, they tend to be free. There's like a conference going on right now I'm going to be heading to with the American College of Physicians. But there's also state chapters. So there's American College of Physicians, which is sort of internal medicine focused. There's American College of Cardiology. Like there are a lot of like the societies made to have conferences of, and they tend to have journals as well. So get involved with things outside of college. I would say that's a huge. I wish someone told me that in college. That I wish someone told me like you can get involved with things that are not on campus. Like get involved off campus because that's where you'll get the most professional experience. Um, so getting involved in conferences, networking, turning on your networking face, you know, maintaining your LinkedIn, connecting with people on LinkedIn, establishing relationships, and then asking them later on, like, hey, like, I saw this paper I read this paper you recently published. I want to work on this work with you, or I really liked. What I look at the future directions in every paper of an author, and I say, hey, like, let's work on these future directions. Like, if you wanted to do this, I can help powerhouse that with you or with your team, or how can I volunteer for you? Because a lot of research tends, it depends. NIH pays students. I did unpaid research. So because when you're unpaid, they feel more bad. They want to put you on the papers because you know they're paying you in terms in with authorship instead of monetary. So if you are able to like try to go for unpaid internships or which is it's a privileged stance to take, I would say. But if you are getting unpaid, that probably increases your chances of getting a publication. That doesn't mean that if you are paid, you won't get published or get your name on a paper. That's just one way I've seen pre-med students go about it. Students
Like
can also,
undergrad research, like also you can get class credit for it. So like the undergrads that work in our lab will get class credit during the semester, and then if they work in the summer, they get paid. So they're always getting something, some sort of recognition or
yes.
credit for the work that they're doing.
Yes, even though I was unpaid, I did get research credit as well in undergrad. So I got credits for it. And credits do translate to money if you want to, if you can see it that way too, because if you are paying for a summer class, they go by credit. All right. And also you can reach out to faculty at a nearby medical school. Like even high school students do this. Like I have a high school student on my research team currently, and she's doing what she can in her capacity. And then I mentor her, and then the physician also teaches her like, and she's very adept. Like she's been with us for a year or so, and she's learned a lot. She's grown a lot. So and you know, I wish I did that in high school. In high school, I did not know that you could do research as a high school student. I thought that's something you do in college or medical school. So, you know, as a eldest sibling, you know, I can now tell my younger siblings like, hey, you can get involved early on. I'm sort of teaching you guys this. Like it's never too late and never too early to also get involved with research. Um, Sending out cold emails. I know that there are a lot of students who do that. They just send out about it really varies between 20 to 60 emails I've heard, like with your resume saying that you're interested in the research, then you get successful. I spent a semester looking for my research. I sent out about 25 cold emails until I found my position. That's sort of what I did because it was during the pandemic in 2020, so I couldn't really go in person to network in events, and so I guess that was how I had to do it online. Getting involved with local research initiatives. You can research like there tend to be like high school friendly internships like for research. The NIH they allow you to come in at the age of 16 to research with them, so you can apply just at 16. So that's usually the high school age. As high school students or pre-med students, you would most likely get involved with like data collection, entry, and then you'd also be trained in HIPAA, which is HIPAA training, and then you do some other trainings to be more compliant with your team. But that way, you would have access to patient protected data if you are dealing with patients. And Robin, are there any specific trainings that students do if they have to work with like lab animals or like even like or lab bench research, or are they expected to come in with those skills?
No, there's training. You'll have facility specific training, and then there's also the Animal Care and Use Committee. So that's like the IRB of animals. So you have to do all of their training. So you get
So
added to protocols, to an animal protocol, just like you would be added to an IRB protocol.
that brings me to my next one. Like, what is an IRB?
So the IRB is the Institutional Review Board. So they're basically in charge of making sure that human research is safe and, you know, it meets the principles of like justice and beneficence, right? Like, so you're not doing harm to people. So they make sure that all of the things that you're doing are done correctly, the way that they should be done. Sometimes it's really a pain because it can take months to go through IRB review. And even when you're like, so one of the nice things about doing basic science research or animal research is that things tend to move much more quickly. Like, and the human clinical trial that I'm running, we had to change our age range by like 2 years, and that went into full IRB review. And so that takes an extra like 2 months for it to get approved. So clinical research is great, but there's definitely some rate limiting stuff that can make it frustrating.
And take longer. You're right. And in clinical research, my retrospective data or case control studies that I do, they tend to be IRB exempt. What that means is I'm submitting an IRB application right now with my mentor, but because I'm not dealing with human subjects like actively, I'm just looking at their charts and data. That tends to be exempt, which basically means I should be like automatically approved to do my research and have access to the charts because I'm not doing any interventions or anything to the people because they've already been discharged from the hospital and they're living their lives. All right. No, thank you so much. I know when I was an undergrad, I did not understand what did IRB exempt mean. Like I would hear my mentor say it all the time because I was in that realm and I was like, I had to Google it. Like, what is IRB exempt? And what is an IRB? Basically, every hospital, every institution has an institutional review board, and they get applications from your PIs, mentors, and also now me, like as a medical student, I deal with the IRB, where we apply and we basically tell them what experiment or what our hypothesis and what variables we're going to be testing, what our hopeful outcomes are, and then that needs to get approved. That basically it's people call it red tape, but it's really needed because there was an IRB back when there were unethical experiments going on back in the day. So I'm really glad it exists, even if it is a pain sometimes, even for me, because I know I'm not working on any humans, but I still have to submit it to be exempt from it. But it's okay. Like these are first world problems. I would also recommend students to be familiar with statistics if you like math. I personally ran away from math, so I do not know any statistics, but I always depend on students who do. The good languages I would recommend to know are R, it's like just the letter R. That's good for statistics, and also Python. Programming is loved by a lot of physicians because many mentors don't know or are not as familiar with computer softwares and programs, and they want to try running through things or want to make things faster. So I learned a little bit of Python, and that was loved by my mentor because I could run through specific tasks faster that would have been done manually. So that was super helpful for her and why she wanted me on her team. But in the future, I'm starting to think AI, like being involved. I know that's like a buzzword, and some people, and there's mixed feelings about it. I'm personally excited about it. I do think that the familiarity with AI is necessary. In fact, a lot of research now asks you, did you use AI to write this protocol? Similar to in the double AMC, they discourage you, and you have to like actually write down like you have to check mark something like I did not use AI to write my like secondary applications, or there's a literal check mark now. It wasn't back when I was applying, because I applied right before the AI stuff. But basically they make you check mark that I promised on my honor I did not use AI to apply. But that's besides the point. Basically in research, it's not wrong to use AI. You just have to disclose that I used AI to write this paper, or you also need to be wary because there have been security breaches, like privacy concerns, because if you're putting in your data into a large language model that's public domain, and that's even if it is de-identified patient data, people can actually take that out and like access it from another computer because it's already on the cloud. So these are things just to be familiar with because we can use AI as a tool now that like and then I do encourage Gen Z especially like get involved with it, learn about it because there are also a lot of papers. I'm working on a paper right now for how AI uses like how AI can answer like step one questions, and we did a couple of experiments using the like ChatGPT, which is really fun, really interesting, and I think that that's the new thing, I guess you could say. Like from 2020 to 2021-ish, it was about COVID. That was something that was really publishable. Then the craze sort of died down. That was getting a little less published. Then from 2021, I would say a little bit in 2022, but it really took off in 2022, 2023. is social determinants of health research. That's when it really, I would say, really kickstarted. I could also be biased because that's what I've been involved with, but it's sort of what I've been seeing more and more in the news. And now I guess the new fad or the new research topic that's getting published really fast now is AI, because people want to know, like, whatever is trendy or interesting, that tends to be published a little bit more in journals, and because it's of interest to readers. So people want to read what they want to read. So nowadays it's AI, and it's still social determinants of health. And of course, basic science research is always, publishable. But yeah, these are just things to keep in mind. And I do recommend, if you're interested in math, like, get involved with statistics, take a statistics class, get involved in biostatistics. That's a huge skill to have coming into medical school. I know that I had to learn a little bit of biostatistics in one of my classes. It was not fun, but it was very fun for the students who had already come in with a statistics background or having done statistics in research or through a class or something like that. So it did catch up with me after I ran away from it as much as I could. And I still have to do a little bit of statistical analysis on the papers that I want to be first author for, because I have to learn, the entire process of research. So it depends on the mentor though, and I still want to learn. I don't think running away from your problems is a good thing. But yeah, a couple of tips. Not and then closing thoughts. Basically, you need to stay consistent. Network as much as you can. Develop relationships with people, even if there are people who say no, that you cannot join their research team. Still, like, wish them a happy new year. Wish them like a happy Thanksgiving. Stay in touch with them because they might have openings later down the road. That's sort of what happened with one of my research mentors. I just maintained a casual relationship with them after they said, no, I'm sorry, my research team is full, but if we have openings, we'll let you know. So I wanted to stay in touch with them. So research should not be intimidating at all. You learn in the process. I did not know anything about research until I actually got involved with it. So it's super useful for learning and staying as a lifelong learner and staying up to date. And yeah, I think that concludes. And Rob, if you have any other closing thoughts?
I would just say if you're cold emailing people, the professors that I know get a lot of emails from people. So make sure that there's something in your email that will make you stand apart to make it sound like you actually really care and have put effort into like reading about their work, because that sometimes will get you noticed.
That's very true. I know students who have to send at least 80 emails because they're not personalizing their emails. They're just copy pasting the same thing. And that's why I had to send a little fewer because I was personalizing the emails. That's actually a very good tip. That actually tells you, like, if someone's saying, oh, I sent out 300 emails and zero responses, I don't think that's a problem with the mentors. I think we should also self-reflect and see how are we writing the emails. Like, maybe get a mentor to read an email or get an upperclassman to sort of edit your emails and see how it sort of changes. But yeah, that's a great way to land an opportunity. Cold emails work, not always. I would say 50% of the time work, but there are other avenues as well. There's applications you can do. You can work in NIH, you can apply for research internships. There are databases for this. If you just Google research internship database, there are databases that exist out there for the different universities. And they tend to be open as well to undergrad students. In fact, we actually shared a research opportunities database in the TeleShadowing Slack channel, that I'll be sharing again. So definitely join the Slack, and we'll hopefully see you next week. Next week, we're starting the infectious diseases month. So this is the link to our TeleShadowing quiz, teleshadowing.com/certification, and we hope to see you next week. Thank you very much, everyone. And thank you, Robin.